Good afternoon, and I'm delighted to welcome you all to our webinar, Putting Care at the Heart of Europe, towards a European Care Strategy. This event is being hosted in conjunction with the European Parliament Office in Dublin and Eurofound, the EU agency for the improvement of living and working conditions. It's great to see that so many of you have joined us today, and thank you for that. We have had a very big response to this webinar. And it really underlines for me and for all of us, I think, the importance of this issue at both national and European level. And I would like to acknowledge the presence of Family Carers Ireland, the Care Alliance Ireland, Age Action, the Alzheimer's Society of Ireland, the Irish Cancer Society, and many other important representative groups who've joined us this morning. Many colleagues from the Oireachtas, which I'm delighted to see, many councillors, and, just a huge interest in this. And I think this really shows that it's important at this point to take stock of this issue. In terms of the programme today, my good colleague from the European Parliament, Dennis Radtke MEP, will deliver a keynote address on how carers can be better supported in their role and the broader benefits to our society of doing so, followed by Hans Dubois, who you see there, who will present a recent report from Eurofound, particularly looking at long-term care. Then we will have a panel of expert speakers to give their perspective on the current state of play and the future of care in Ireland and in Europe. And then we'll have a Q&A session. And you can follow the debate online by using the hashtag EU Care Strategy. Please use the live chat function at the bottom right hand side of your screen to pose your questions to our panel a little later on. And the webinar is being recorded. So I would encourage everybody listening to use that, the live chat function. We really want to get your feedback. You don't have to ask a question. You might like to put a statement in, which I can then moderate and let everybody know what's coming in. So why this seminar? Why now? Well, of course, care is always an important issue. But I think the COVID-19 crisis has it really necessitated a review and reconsideration of how we view work and care within our society. In April, my group in the European Parliament, the EPP group, called for the introduction of European Care Strategy as part of the first reaction to COVID-19. And we put forward an outline, Dennis and myself, of what we thought should be in a European Care Strategy and how we can really utilise the best of the EU in terms of gathering data, best practice, exchanging ideas across Europe, looking at the situation of care in different member states. Many of you on this call have been working on care issues for a long time. I know many years ago, volunteers, people who were providing care in the home, got together, formed societies, wanted to bring an increased awareness in Ireland about the financial needs, the care needs, the breaks that were needed, and so on. During COVID, we've seen applause for frontline workers, but of course, applause isn't any good if we don't translate it into concrete actions. And it's been very interesting for me as a member of the Parliament to see the differential approach. And some of our panel will speak about that. How care is viewed across the EU varies quite a lot. So we need to examine that as well. One of the things I've taken a particular interest in during the past year as a member of the Parliament is the differential effect of COVID. And I'm doing a report on the differential impact, for example, on women in the COVID crisis. It affects, of course, both women and men. We see differential in younger and older, different income groups, and so on. Many differentials. And we need to really understand that when we talk about the impact of COVID. But could Europe do more to support carers across the Union? Is the political will there? Will people say it's a member state responsibility and there isn't a role for Europe? And what should we focus on? Should it be the continuum of care? That's from early years, from childcare to elder care? Or should we focus on carers and those being cared for in the older population? Different approaches are considered as to which we should focus on. But they're very fundamental questions. But we do know that the issues around childcare are very different to the issues around caring for older people. But nevertheless, it's a care situation. One of the points I suppose I would make is that when you look at the statistics around care and across the lifespan, there is one thing that is very striking, and that is the number of women who are involved in care, either paid or unpaid. 76% of healthcare workers across Europe, 93% of childcare workers, 83% of cashiers, as we saw. Very interesting statistics emerging. But of course, it is about how women and men work together on this issue, and it's also about sharing responsibilities. So I think also in the Irish government, just to mention, it's very important, the importance of a new care deal has been highlighted in the 2020 programme for government, with a commitment to establish a new social contract and a commission on care. So these are all topics that I hope that we will touch on in various ways today. I'd now like to introduce my colleague, Dennis Radtke. He's a German member of the Parliament since 2017 for the CDU party, is a member of the EPP group in Parliament, member of the Committee on Employment, where he does an awful lot of work, employment and social affairs. He's the rapporteur for that, the coordinator in that committee for our EPP party. And he's worked on this issue. So I'm delighted to invite Dennis now to give you a European perspective on care and a European Parliament perspective. Thank you very much, Dennis.
Yeah, thank you, Frances. Dear colleagues, dear friends, ladies and gentlemen. As you told, I'm from Germany, so I'm not a native English speaker. I hope for your understanding that it is always much more difficult to speak in a foreign language than to express yourself in your own language, but I will try my best that it works out, and I hope for your understanding. And first of all, let me thank you very much for the opportunity to speak on this very important topic that is very close to my heart. It's really an honor and a pleasure for me, also because with Frances there is a very trustful and good cooperation between the work in the Ample committee, which I'm the coordinator in, and the FEM committee from Frances. But there's also a very good and trustful cooperation with Maria Walsh, who is in the Ample committee. So the Irish EPP delegation is really a delegation I learned to rely on, and thank you for that. So it's of course a pleasure for me to be with you today. In my eyes, the discussion on the carer situation, on the carer strategy, comes at the right time, because we are now, on the one hand, trying to prepare the European carer strategy. Frances already mentioned this. And on the other hand, the issue of care has gained a lot of political momentum in our society due to the COVID-19 pandemic. So to be very clear, when there's something good and helpful on this damned COVID-19 pandemic situation, then that it puts a spotlight on some political issues which were not so much in the focus before the COVID. It has been important for especially from my perspective, as someone who worked for a trade union in Germany and is doing social politics now in Parliament. But now it really helped a bit to put the spotlight on it and to take some action. Although you will always find some colleagues who say this is not the right time to discuss social topics. In my eyes, it is now the right time to discuss the social topics. And of course, the carer situation is one of them. And we still remember the time when everywhere in Europe, people were standing on the balconies to clap for our healthcare workers and all the other frontline workers. But this was a nice sign of appreciation. But in the end, to be clear, it was not more than that. And I think we have to deliver more than that, we owe it to that. We owe it to the people. I saw it a few weeks ago here in Germany. There were collective bargaining for the sector, and I asked myself, where is now all the thankfulness, gratefulness? Where has it gone in this concrete situation when we are talking about more money for the people who are doing that important job? So clapping your hands is nice, but I think as politics we have to deliver more. And on the other side, we saw how fast the virus spread in care facilities, resulting in hundreds of deaths because the facilities were not prepared for a situation like that. And we now need concrete political action to improve the situation of both, of caregivers and of course also of the people receiving care. And in my eyes, it starts with better payment, I already mentioned, and better working conditions for professionals, and recognizing the role that informal caregivers play in home-based settings. So we also must focus on the fact that more caregivers are women. I come to that later, a point that Frances already mentioned in her introduction. So how can we improve their situation? And I think that a European carer strategy is a good start to bring this issue also on the European level. And I know and Frances knows all these guys as good as I do. You will always find some skeptic colleagues who say, oh, Jesus, what are you doing again? The next thing that should be solved by the European Union. This is up to national government to take action. This is not a European topic. Well, my personal belief is not every solution must come from Brussels. Not everything should be related from Brussels. But this is, and we see it especially now in the COVID situation, this is a European topic. And so we have to make clear what can we do as European politics to help. And I appreciate efforts like from the Irish government establishing a new social contract and a commission on care. I think that these programs need to be complemented by European actions. That's what I just said before. National action is needed, and national action is done, like the Irish government is showing now. We have also a lot of political discussions in Germany on that. But Frances and I, we are here to work on a European perspective on this, and a European carer strategy, fully respecting the principle of subsidiarity, could perfectly set out minimum standards on care and facilitate the exchange of best practices. This should absolutely be possible, also in the light of subsidiarity. And there are few sectors there are only a few sectors with a higher workers' mobility in Europe than the care sector. When I look to the situation in Germany, we have a lot of, especially women from Eastern Europe, from Poland, who are working in the care sector in Germany. So on this labor mobility, you see there is a big European dimension on this issue. And the situation in Germany, of course, is similar to the situation in many other countries. So in my eyes, it makes absolute sense to set out minimum standards on the European level. And this would help both the caregivers and, of course, the care receivers and their families. And another important part of the strategy will be how to tackle the problem of women participating less in the labor market because of care responsibilities. That is what Frances mentioned already. And if you see around 50% of under 65s combine care with employment, of which most are women. And this is, of course, one thing which is causing the part-time trap. It starts with taking care of your own children, and it ends with taking care of your family, of your relatives. And the overwhelming majority is women doing that work, and that causes a lot of problems. Especially when you see in Germany, that causes a big problem in the pension situation, because if you have worked many years only in part time, then you see it, of course, in the end in the pension situation, and we have to discuss about that. And of course, there is a development also in Germany. You have more and more young men who want to take responsibility for their children. But I think there's still space for development on that, and especially in taking care of elderly people and your own relatives. So here we still need to provide credible solutions, and I think on the topic childcare, we delivered the first step in on the European level with a guarantee that fathers have the right to take a parental leave. We delivered this last year, and I think this is a first step, and we can discuss about further steps with you on the care situation. So, however, I'm sure that this is a topic that Frances will want to talk about. So I would like to leave it with that, and thank you very much for the invitation and for the opportunity to give you my point of view. Thank you very much.
Thanks very much, Dennis, for that sort of very broad picture that you painted, but very clearly showing the impact of care and the connection to whether it's labor market mobility, how we treat maternity, parental leave, paternity leave, those labor market implications, pension gaps. It's a very broad picture, as you say, and also the potential then to work at European level, as we've done in some aspects of childcare in terms of best practice, sharing data, and so on. So Dennis, thanks very much indeed for joining us and giving us that introductory setting of the scene as you see it from a European Parliament and a European point of view. Thank you, Dennis. We're now going to move on to Hans Dubois. Hans is a research manager at Eurofound. His very wide interests from a research point of view. He looks at household over-indebtedness, he looks at healthcare, long-term care and childcare. And he's also looked at the current situation in various EU member states, and he's going to tell us something of recent reports and what they're indicating in relation to care issues across Europe. So over to you, Hans.
Thank you. Yes, so care models differ largely between member states. And with regard to formal care services, in a report on access to care services we mapped, published in October, we mapped how these access problems vary. There are very different types of access problems and magnitudes of access problems across the European Union, and provided a comprehensive framework, also applying to childcare, long-term care, and healthcare, actually. But for any scenario which looks into developing care services in the future, there are three striking gender dimensions which I wanted to highlight. As Dennis Radtke already mentioned, most informal carers are female. That's true for childcare and for long-term care. Now, good access to quality care services provides relief for them. It should be noted that, yes, several combine it with work, but actually many do not. They are not of working age, but also for them, these care services provide social, allow them to be socially included, and they're good for their health as well, if there's some relief. Then second, actually, for long-term care, most of the users are also female because women live longer. And then a third gender dimension, so quality services is important for them. And a third gender dimension is that women, as Frances Fitzgerald mentioned, that women make up most of the care workforce. Well, this is true for long-term care, and this has been very stable over the past decade, as we saw in the long-term care workforce report, which will be published the 14th of December. But it's even more so for childcare. Almost the entire workforce is female. Now I wanted to focus on long-term care, where the needs are increasing fastly. And this is reflected by an expansion of the long-term care workforce by 1/3 in just one decade. And it's up to 6.3 million people working in long-term care for disabled and older people in the EU. Now, informal carers play a significant role in all countries, with 44 million people who provide frequent long-term care to family or friends with disabilities or chronic illnesses. And so, given that it's such a large number, 7 times more than formal long-term care workers, even though that expanded a lot, informal care is here to stay. Now, let's have a look at COVID now. COVID has increased pressure on many informal carers because formal care has been discontinued often, and also there's been a decrease in less frequent long-term care. So there's more on the shoulders of people providing frequent long-term care. Now it's important to stay in contact with these informal carers and long-term care users, and to engage on how effectively support both care receivers and carers now and in the future. Flexible respite services could be part of the answer, which are fitted to the needs and preferences of care users and their informal carers. Not all member states have such services, and they differ largely in what type they are precisely, but they are debated in all of the member states, as our report on access to care services showed. Now, as was also mentioned, care homes have been at the epicenter of deaths during the COVID crisis. They were often not equipped well to face the crisis, and trust in and preference for residential long-term care is likely to have decreased. So this may accelerate the move to home and community-based care, which puts deinstitutionalization into a new light. I also wanted to highlight the role of domestic carers who are employed by the care receiver, because there are specific challenges for working conditions and for the quality of care. For instance, while rare in long-term care in general, undeclared work is very relatively common there, with no sick leave entitlements, which also has caused that during the COVID crisis, first of all, many domestic carers have lost income, but many others have been going to work, and there's a large incentive to go to work even when they are feeling ill, which is obviously not good in the COVID context. And now this group of domestic carers also include live-in carers who live in the home of the care receiver. This is a key component of care in 7 member states, so important, and with benefits also in the context of COVID, because they live in with the carer, so very limited contacts with others. But they come with challenges for ensuring quality of care and for decent working conditions. Now, some countries have shown that you can effectively regulate this group, Austria, or with collective bargaining, improve the conditions there in Italy. But many countries have also shown that living care is actually not really needed if access to flexible, good quality long-term care is provided. Now, lastly, I wanted to highlight the importance of preventing ill health and postponing long-term care needs and of promoting independent living that remains acute. So actually important action should come from outside the care services sector as well, by ensuring good working and living conditions across the life cycle. And also, for instance, high quality housing and good quality local areas, the social service dimension, the physical dimensions of the local areas can prevent illness and also enable independent living. But care services can play a role as well. And that includes also social services and so other social services and healthcare, with long-term care also. And in particular, if there's early engagement by care services with people with modest long-term care needs, this can contribute to early signaling and prevention of further long-term care needs. Now, lastly, I just want to close with the point that I cannot emphasize enough that it's important for care services to be effective, that it's important to listen to those who will use them and their informal care. So we will look forward to the panel discussion now. And also just to note that we are just started a project looking into the impact of COVID-19 on living conditions of older people and their care needs. Okay, thank you.
Thanks very much indeed, Hans. I think you make some totally important points there about the context. The social and economic context will, of course, impact on carers and those who care for them. I thought the point about trust in long-term care decreasing is one we should talk about and very concerning. And also, of course, the need to continue to have the focus on independent living and how we can support care is very important topics right across Europe, as you say. So now we move on to our panel discussion, and let me tell you who we have on the panel discussion, and I'd remind everybody who's logged in as well, this goes to 1:15, so be sure to send your comments and questions in and your thoughts on this discussion. We're already getting some very interesting points, and I'll try and bring as many of them to you as possible. Now, on the panel discussion, we're joined by Minister Mary Radtke, TD, Minister of State with responsibility for mental health and older people, John Dunn, CEO of Family Carers Ireland and former president of Eurocarers, Sandra McCullough from the Women's Economic Equality Coordinator with the National Women's Council of Ireland, who's here on behalf of Orla O'Connor, and Stacey Yegmonis, Executive Director of Eurocarers. So thank you all for joining us today. Firstly, I'd like to introduce Mary Radtke TD, she's a colleague of mine. We work together in the DOR. Mary is Minister of State, as I said, at the Department of Health, with special responsibility for those important areas of mental health and older people. She is a TD representing the Water constituency since 2016, having previously served as a councillor. And in the 32nd DOR, Mary served as chairperson of the Joint Oireachtas Committee for Business, Enterprise and Innovation, and the all-party group, Oireachtas Group on Dementia. So she's very interesting experience both on the business side and on the care side. So, Minister, thank you for joining us today. Delighted to see you. And over to you for some high-level comments, which we're going to get from each of our panel members, and then we'll move into the Q&A.
Frances, thank you so much for the warm welcome. I'm absolutely delighted to be here today and for the webinar on putting care at the heart of Europe towards the European care strategy. As you said, we worked previously in the last Oireachtas together, and it's fantastic to be here. So thank you for inviting me here. As Minister of State with responsibility for mental health and older people, I've been asked to address government strategy on care in Ireland. At the core of this strategy is our 10-year Sláinte Care programme to transform health and social care services in Ireland to meet the changing needs of our population. This programme is based on the key principle of providing the right care in the right place at the right time. In common with other European countries, our population aged 65 and over is increasing rapidly. Over the next 20 years, the number of people in Ireland aged 65 to 84 will rise by 50%, and the 85+ population by over 100%. This growth will bring many benefits to our society, but also an increased need for health and social services, including for those involved in caregiving. Our programme for government advocates for an age-friendly Ireland and proposes the establishment of a commission to examine care and supports for older people. It also sets out our commitments in relation to home and community care, supports for older people, housing, tackling loneliness, long-term residential care, dementia care and end-of-life care. Implementing these commitments will ensure that our older people can live in their own homes with dignity and independence for as long as possible, and that they can continue to contribute to social, economic, cultural and family life in their own communities. The programme for government also includes specific commitments relating to carers, including to review and update the National Carer Strategy, develop a pension solution for family carers that recognises their important work, extend free GP care to carers in receipt of the Carers Support Grant, and develop a carers guarantee, a proposal that will provide a core basket of services to carers across the country regardless of where they live. Our National Carer Strategy sets out government policy for those who care for older people, children and adults with an illness or a disability. The COVID-19 pandemic has been particularly challenging for family carers, with many now concerned about their own mental health and well-being. In response to COVID-19, there has been an enhanced focus on providing information and signposting carers to community supports. I would like to acknowledge the role played by Family Carers Ireland and other carer representative organisations in continuing to provide supports for carers throughout this very, very difficult time. With additional investment of 2 million in the strategy under Budget 21, we will work with our community and voluntary partners to improve access to supports for our carers around the country. We will also pilot the Intereye Carers Needs Assessment System to ascertain carers' needs. In addition, Budget 21 provides for an increase of €150 in the annual Carer Support Grant to €1,850, benefiting over 130,000 carers. In Ireland, the gender dimension of care is clear, and it is a key aspect which informs our government strategy with regard to care. Women account for over 60% of informal carers and provide almost 2/3 of all informal care hours. A Women's Health Task Force established by the Department of Health is to improve women's health outcomes and experiences. Recently heard presentations from carers directly and considered women's experience of caring during the COVID pandemic. The National Women's Council of Ireland are a core partner of the task force, and I am delighted we will be hearing from them today. More broadly, I am fully committed in my role as Minister of State with responsibility for older people to enhance community supports for older people, including the provision of an additional 5 million home support hours next year. We will establish a new statutory scheme for the financing and regulation of home support services, which is currently being developed. The new scheme aims to ensure that everyone has equal access to home support on an affordable basis in accordance with their assessed care needs. I am also committed to implementing the report of Ireland's COVID-19 expert panel on nursing homes, which has made recommendations to enhance the readiness of nursing homes to respond to further waves of coronavirus in the months ahead. The government is committed to protecting residents of nursing homes, taking into account the significant adverse impact of COVID-19 and its associated restrictions on this vulnerable group of citizens. Finally, our government is committed to reviewing and updating our own national carer strategy in collaboration with our key stakeholders. In that context, we are very interested in the initiative to develop a European care strategy and look forward to hearing about its progress. Thank you once again, Frances, and Gaurav Mila Mahabut.
Thank you very much indeed, Mary Minister. We really appreciate you being with us. And clearly there are very ambitious plans. And I suppose the big challenge is going to be the resources, given COVID-19 and the huge demands on the exchequer and the economy. but it's great to have the vision of what we want to do. It's about how we implement it now, and I'm sure we'll move on to that. Thank you very much indeed. Now, I want to introduce Mr. John Dunn. John was appointed Chief Executive of Family Carers Ireland in 2016 when it formed from the merger of the Carers Association that many of us knew and the Caring for Carers Ireland. So the early part of his career was spent in a variety of civil service roles, including with the Minister for Foreign Affairs. John was also a member of the National Economic and Social Council for 9 years and served as president of Eurocarers, the European organisation working for family carers, for 4 years, from 14 to 18. This year, Family Carers Ireland was nominated by the Irish EPP Group for the European Citizens Prize to highlight and pay tribute to the vital role of carers in our society and the community spirit that they really exemplify. So, John, I know from speaking to you before, you have an awful lot of experience on the ground, and you've also seen the situation across other member states in Europe. So, look, over to you now, John, and thank you for joining us.
Thanks, Frances. I'm going to try and present something that kind of is coherent at a national level and also at a European level. I'm starting off by saying I'm going to focus on informal carers as they're described in European terms normally, but we call them family carers in Ireland. But clearly any strategy has to take account of the care recipients and also care workers, just to say they should all be part of the strategy. I won't say a whole lot on the gender issue. What's been said before is valid. I just enter two small caveats. The first one is, while the majority of care providers are women, there is a significant minority who are men, and they shouldn't be forgotten either. But also, when you look a little deeper, what's more interesting perhaps in ways is there's quite a distinct gender differentiation in terms of the type of caring activities that each gender provides over time. So that's another aspect of the gender issue. In terms of COVID, I suppose it's fair to say it's been an interesting learning time for everybody. The fact of the matter is, people being on furlough, some of them have been able to focus more on their caring role and have found that they were able to dispense with services being provided by the state because they were at home more. And from a safety point of view, they preferred not to have strangers coming in. Other working carers undoubtedly found that their work-life balance was under increased strain. And to this day, service restrictions because of social distancing are still a huge challenge. Noting that budgets are still being used, and particularly in the disability sector, where some carers would have an individualised budget, which is designed to guarantee them a certain amount of service. They're coming now to the end of this year and being told, well, the budget's all used up, you didn't get the service, but we had to spend it on other things. So there's been that kind of challenge as well. In terms of framing a strategy on carers at European level, we've had one, I'm happy to say, in Ireland since 2010. The Commission approach, I think, has initially started by focusing on the sustainability of long-term care as a socio-economic challenge. And then in more recent years, the European Pillar of Social Rights has opened the way to a different kind of dialogue. One piece that seems to me, in terms of experience in Ireland, that will be a challenge is, to us, it makes sense to anchor caring as an issue within the health system. And while that is problematic in terms of treaty competencies, but I think the issue, even within the health system, can be framed as a socio-economic one. Because in pretty much every country in Europe, the invisible workforce that informal carers represent, if it was to be replaced in terms of a minimum paid service, it would probably double the cost of the health budget in every country. And given that most countries are already spending an awful lot of money on health, that's not a sustainable issue. It's not a sustainable approach. So there is a socioeconomic challenge there, which possibly is a way of dodging the bullet of the health system. In terms of the framework working across Europe, it's very interesting, and I didn't realize this until I was involved in European level for a number of years. There are three distinct models to the approach of responsibility of care for the elderly specifically across Europe. One is where it's defined in law as being primarily the responsibility of the state. That'd be normally the Scandinavian countries. The other situation is where it is defined in law as primarily the responsibility of the family. And the third situation is where there is no definition in law. Ireland would fall into that space. We tend to be very comfortable with ambiguity, but the reality is that's the minority position. What's most interesting when you look at that over time is that those three models are being forced to converge. So states, as I say, mainly the Scandinavians, who have said this is the responsibility of the public sector to deliver this support and service, are finding they simply cannot do it without family contribution or family support. We see that in a slightly different way in the German insurance model, as I understand it. If you don't have children, your social insurance contribution towards your long-term care is slightly higher, because the assumption is if you do have children, they will make a contribution to that care. The most extreme interpretation, perhaps, of the family responsibility was in Estonia, where the state effectively took the position that if you had offspring, the state accepted no responsibility for looking after you in your old age at all. They're now finding that's not sustainable either, so the state is having to step in. It always did a little bit for people who didn't have children, but now it's kind of having to extend that model. So you're seeing a convergence there, and anywhere I think you're seeing a convergence at a high level across Europe, there is scope to frame something which is capable of including everybody, and that's positive. The second dynamic that's going on as a conversation across Europe, and again it seems to be pretty consistent, is the attempt to rebalance the health system between treatment of acute conditions in hospitals and treatment of chronic conditions through a community-based response. And I think most systems are struggling with that in terms of the achievement. Some have tried to accelerate it by splitting health and social care. That's not the situation in Ireland. And when I've talked to various Irish ministers about this, they've said they've taken soundings from some of the European colleagues, and the ones that had done it said, don't do it. It's not a good idea to do this separation. But if you put them all together, there's no doubt that the acute side will usually crowd out the social care side. So there is a challenge in achieving a balance there. In our experience, the needs that family carers have, and I think Hans talked about the importance of meeting some of these needs, but the needs they have, they fall into three groups. They need supports in terms of health and social care supports, but they also need broader socioeconomic supports around things like income and housing and transport. And they also need psychosocial supports in terms of their own personal mental health and also managing the family dynamics sometimes. And it's interesting that if you try to locate what agency could meet all those needs altogether, there is no agency that I've ever come across anywhere in the public sector who can do it. So to me, that points to a role for the NGO sector, the voluntary sector, to act as a bridge between different elements of the state system, to act as a lubricant around the system to enable that to work together. Just to note as well, a pattern that's happened in terms of in Spain and the UK, certainly, there's now a statutory right to an informal care needs assessment, but there is no right to the service to meet the needs that have been identified through that assessment. So I just mentioned, I don't think that's a particularly satisfactory model going forward. We wouldn't be inclined to encourage that. But what we are advancing in Ireland is the idea of a carer guarantee, and that is a basic bundle of services and supports that can be provided quite cost effectively to carers throughout the country, and that take about 80% of the burden of sustaining the caring role going forward, and more or less respond to it in a very efficient and effective way. And I think that's all I'd like to say at this stage, if that's all right, Frances.
Thanks very much, John. Yes, I mean, I think it's interesting that you're saying that more and more countries are finding that you can't either say it's all family or all government, that it's, we have to move to that bundle of services that are essential for people. But thanks for that overview, John, really appreciate it. And also the point about men, I think, yes, sometimes when you look at the statistics, we do know that there are significant numbers of men involved as well. And we have to be careful in our descriptions, I guess, to get more qualitative data about that as well, because we all obviously know individual carers who are men and who are women, but we have a predominance of women, of course, but the needs are the same whether you're a man or a woman in the caring situation. Now we move on to Sandra. Sandra McCullough works for Women's Economic Equality as a coordinator with the Women's Council. Her work focuses on the areas of gender and equality budgeting, the care economy, which we're discussing today, social welfare, taxation and investment as related to women's economic equality. She's worked in policy, research and advocacy roles in national organisations in the NGO sector for 15 years. And Sandra, I know firsthand the research you do. It's absolutely fantastic, and you produce some great documentation and publications in recent years. So Sandra, look forward to hearing what you have to say now to our listeners.
Thank you, Frances, and thanks again for the invitation to take part in today's webinar. It's been really interesting to listen to the previous speakers, and I suppose a lot of what's been said chimes with our experience in the National Women's Council. So I suppose the National Women's Council has long advocated for the need to recognise and to value care in our society. Care work is essential to the common good. As we've all seen over recent months, it's vital for a functioning economy and society, yet it's hugely undervalued. So I suppose in the Women's Council, our understanding of care is broad and acknowledges that across the lifespan, we all both give and receive care, and that this is a deeply fulfilling and necessary human experience. Our feminist understanding of care acknowledges that disabled people and older people, they're not passive recipients of care, but rather they're individuals whose rights are intertwined with the predominantly women that provide care. So though care and other domestic work is essential to kind of individual, family and society well-being, it's time that can't be spent on other activities, such as paid work, education and training, political and civic engagement and so on. So this then has implications for women's position in society, their participation in the labour market, their financial situation, of course, as well as their pension provision post-retirement. So one of the challenges really is that while there has been a significant increase in women's participation in the labour market, this hasn't been matched by an equal increase in the contribution of men to domestic or care work. So just this morning, EGA, the European Institute for Gender Equality, they published a report which found that across the EU, the bulk of unpaid care work is still being done by women, and that this pattern holds true for women who are actively engaged in the labour market as well. Previous research then has found that people in Ireland do more unpaid caring work than anywhere else in the EU. And while the level of unpaid care work is high for everybody, for women and men in Ireland, women continue to do the majority of unpaid care work. And if we look at the intersection then of gender and class, it's women on lower incomes that do the most unpaid care work. If we look at paid care work, then women also predominate here. So in Ireland, practically the entire childcare workforce is made up of women, and they're some of the lowest paid workers in the economy. So 6 out of 10 childcare workers in Ireland earn less than the living wage. In terms of domestic and personal care workers, they're often migrant women workers and women of colour, vulnerable to precarious work and exploitation. So in the Women's Council, we're particularly concerned that we can't become dependent on the exploitation of some of the most vulnerable women workers to meet our personal care, our familial and community care needs. In terms of gender equality then, the provision of care services such as childcare to enable women to access the labour market, it's crucial, but it's not the only solution needed. So recent research by Task, for example, found that in countries with a more expansive care system, there's actually a bigger gender pay gap, as while childcare frees up women to go out to work, gender segregation in employment means that women predominate in low-paid work like the care sector. So this points to the need then, I suppose, for broader policy responses to ensure decent jobs for women. So, some of the things we would like to see addressed is, one important but challenging piece is the need to change men's attitudes towards care. We won't see more men working in the sector without addressing the institutional and cultural barriers to men entering female-dominated professions. So if we address the poor pay and the low status attached with stereotypically female-dominated professions like care, we'll likely see a better gender balance in the sector. Another thing is we need to see more care-friendly workplaces where workers are facilitated to combine part-time work and care needs. So this includes policies on flexible working, but also statutory leave policies that focus on promoting greater equality in the uptake of parental leave between women and men, as well as reduced working hours across the board, such as through things like a 4-day week. investment in the care economy, we've heard a bit about that. For us, this is crucial, and it must include investment in a public model of early years education and care. You know, for us, that's the best way to provide affordability for parents, but also decent pay and working conditions for the workforce. And we also need to see investment in social care services like home care and personal assistance services for disabled people. The last point I'll make then is just, Radtke mentioned this, as collective bargaining it's a key mechanism for improving pay and conditions for care workers. Research has shown that in countries with a high coverage of collective bargaining, they tend to have shorter working hours for both women and men, more flexible work options, more secure employment conditions, better protection for non-standard workers, as well as a reduced gender pay gap. So I'll leave it at that. I look forward to this discussion.
Thanks very much. Listening to you, Sandra, I'm very struck, as I always am, how much the whole care situation gives us a lens into, you know, how we value or don't value care, women's work, and the big equality issues around it. And yet, as we've seen right through COVID, and of course before that, how central the quality of care is and how much people care actually about it. Families want good care. We want to see, you know, our long-term, you know, residential nursing homes, we want to see the standards being really high. And yet, when you describe the actual reality, it is so disturbing, I have to say. And that's why I think this lens today is so important. Our final panelist is Stacey Yetmonis. Stacey, thank you so much for joining us today. He's the Executive Director of Eurocarers, the European network working with and for informal carers. Eurocarers bring together 73 organisations from 26 countries. And he's an EU policy and communication specialist. So I have a lot of questions for you afterwards, Stacey, because there's a lot of questions coming in about how we pay for a better European response and how, you know, whether we should look at legislation and so on. It's quite interesting. So over the last 17 years, Stacey has been involved in a number of organisations focusing on the implementation and reinforcement of EU policies in the areas of press freedom, social equity, children's rights, as well as health and social care. So Stacey, over to you, and then I'll move on to the comments and questions that are coming in from everybody who's been logged on today. And thank you again for staying with us. Stacey.
Yeah, thanks a million. I'm delighted to be part of this conversation, and I'm delighted to see such a conversation taking place. You know, I'd like to say finally, it is not only a timely initiative, this idea of an EU strategy on care, but if you don't mind me saying, it's high time we did something about care and caring at European level. So I'm going to try and build on some of the points made by my colleagues earlier, and maybe try and, you know, and recall the information we already have at disposal about the situation and needs of carers across Europe. First of all, we know that carers are the main providers of long-term care. And by the way, when I say informal carers, I mean people providing unpaid long-term care. So we know they're the main providers of long-term care in Europe. According to some estimates, as much as 80% of all long-term care in Europe is actually provided by families, friends, neighbors. We know that if we were to try, and John touched upon that, if we were to try and replace informal care by formal care, gradually that would essentially entail building a second long-term care system and financing a second long-term care system entirely. So it's, as it stands, at least absolutely impossible. And we also know that the impact of caregiving on carers themselves when they don't have access to adequate support is also pretty big in terms of access to employment and full-time employment. This is, of course, particularly the case for women, but also in terms of poverty and social exclusion and health and mental health. We know, for example, that the prevalence of mental health issues among non-working carers is 20% higher than among non-carers. So all of this has obviously a cost, a social cost for carers themselves, but also for the economy as a whole. because that converts carers into patients themselves. It is a vicious circle. So we need to do something about carers, and we need to understand that whether we like it or not, indeed, as Hans nicely put it, carers are here to stay, and so we cannot ignore them anymore. And this is the reason why we introduced almost 2 years ago, well, exactly to the day, the idea of an EU strategy on carers, which builds on 10 easy steps, or at least we see them as fairly easy, to develop what we consider a carer-friendly society, starting with a good and comprehensive definition of what informal care is. And Ireland, at least from our perspective, has a pretty good definition. But obviously, you need to take into consideration the fact that in countries, in Eastern Europe or Southern Europe, for example, the situation of carers is still extremely difficult, and those millions of people suffer from a complete lack of attention and recognition. Now, all of these challenges pre-existed the pandemic, and the COVID crisis did nothing but exacerbate these challenges. Carers are now, for a majority of them, completely isolated as a result of the confinement measures. The support services they had access to when in existence have been reduced or have disappeared. They struggle to find information about COVID and how to handle it. They struggle to have access to personal protective equipment. And so, again, the crisis shows the crucial role played by both professional and informal carers. And so the way we see it, we need an approach, an EU approach, which takes into consideration both aspects together, because they are closely interrelated. And it's a question of striking the right balance between professional and informal care, to make sure everyone has access to good quality care in Europe, but also to make sure everyone has a choice, if they wish to do so, to be involved in caregiving and to have access to good quality support to do so. So we very much welcome the idea of an EU strategy on carers. We're more than willing to collaborate with you to further define what it may look like. And I'm sure there's a long list of stakeholders attending the webinar today who probably also have a lot to contribute to this discussion. So I'll leave it at that for now. Thank you.
Thanks very much, Sophie, for outlining the kind of combination of professional, if you like, and care workers and informal, and how we need to bring it all together and have those basic services there for both. So thank you for giving us that European perspective on it, and your support for a European carers strategy, and that it can actually help member states. So to move on quickly then to the questions and comments that are coming in, and perhaps our panel members, I might call on somebody to answer first, but if anybody else would like to comment on the question, if you would just raise your hand so I can see you all now. So let me start with a question from Zoe, who says she underlines it is important to make sure there is parity across member states for family carers. Right now, there are huge differences in supports and services for carers between countries. How do you see a European-wide care strategy roll out? That's the first question. So just have a think about that. And then there's another one. It's a perennial. It's one we've talked about for a long time. And they should say the younger generation, I think, are getting better at this. I think it was Hans who said it. Question from Harold from Vienna on the gender aspect. How should we implement measures to increase participation of men in care activities and better reconciliation of family and work for women and men? And I think Sandra made the point, of course, if you have better conditions, that certainly makes it more attractive to have both women and men working in areas, and that's about increasing pay. And of course, that then, as I think it was Dennis said, it can be quite difficult. So to go back to the first question, Stacey, I think I'll start with you just on that one. How do you see a European-wide care strategy rollout? What would that begin to look like?
Well, I think as Mr. Radtke mentioned in his introduction, even though there's no mandate for the EU institutions in the care sector, there is a role for EU institutions to coordinate a dialogue between member states about these questions. There's also a role for EU institutions and the Commission in particular to provide a platform for the exchange of good practices. And the Commission, in fairness, has started, has pretty interesting initiatives related to the topic in the pipeline. I'm thinking about the action plan for the implementation of the social pillar, or the upcoming green paper on aging, which it seems will also look into the issue of long-term care. So that platform, could easily be provided by institutions, and the added value at European level, I really want to insist on that, relates to the fact that those challenges are common across member states when it comes to both professional and informal care. When it comes to professional care, the growing demand, the declining supply, the quality challenge, the sustainability challenge, they are common across member states. When it comes to all of the challenges I mentioned about informal carers, the same. All member states are facing the same issues. So there is clearly an added value in this discussion at European level. And the EU Pillar of Social Rights and Principle 18 on long-term care in particular has opened the door for that.
Stacey, I do find at European level there can be resistance on social issues, but as you say, the European social pillar should really give us scope. And historically, the EU has always done quite a lot on social issues in terms of, raising, if you like, the profile across the member states, which then really helps, governments to be more involved. Mary, you'd like to come in on this one.
Yes, thank you, Frances. Having listened to all the speakers, I think we've very much in common across all the countries. We're all trying to achieve the same thing. We're all trying to strike the right balance, access to good quality care for people who need it, supporting people to live well and to age well. And there is no doubt about it, we can learn so much from the other member countries. And I think it's a great opportunity if we do collaborate together, because, lived experience is absolutely fantastic, and learning from different challenges in different countries would be very helpful.
Thanks, Mary. I might go to Hans to make a comment on that. How would you see a European care strategy roll out, Hans, from what you're seeing in your research? Where do you see the need for action, if you like?
Yes, well, one thing I would like to highlight. So, while the issues are similar across the EU, there are, of course, huge differences also in support for informal carers, but also, of course, massive differences in access to long-term care. It's mainly the 14 member states with the lowest GDP. Basically, they have rather bad access to long-term care, while the others, there's variety, but they have much better access. So there's these basics. It would be good if these basics improved across the board, at least to a good level. Also, maybe the flexibility that cannot be highlighted enough. All the households, or the persons with care needs, their carers, they have very personal circumstances, and it would be good if as you were saying before, that it's not just state or informal, but if there's a good if combinations thereof are facilitated. So maybe some home care in combination with informal care, and in a flexible and tailor-made way to the preferences and needs of the individual situations.
Yes, thanks, Hans. I mean, that's an interesting point, that as countries' GDP gets better, then we seem to move towards a position where there's greater recognition of both informal and professional care. And I mean, that does make sense, but it does bring up the point about COVID and the economic consequences and what they're going to be on care, I think. John, you might have something to say on that. I mean, I'm thinking about the national recovery plans. I mean, what's your experience of maybe getting some of the care issues into national recovery plans? And then I'd like to go to Sandra on the question of the reconciliation of work and family life and the greater role of men. But John, you might make a comment on that point first.
In terms of, I mean, experience is so short and so intense that I don't know that we haven't seen, we've seen an acceleration of stuff that's been happening rather than major new initiatives coming on stream. That's in terms of our own actions and government actions too. Things just have begun to move faster in responding, possibly because before COVID, there was a sense that we have to move slowly and carefully, and during COVID, there's a sense we can't hang around on some of this, and there's also relaxation on the budgetary stuff. Going back to Zoe's question about parity, I think we're a long way away from parity, to be honest, and I think that's probably, in the short term, an unrealistic aspiration. And what Stacey was talking about in terms of dialogue, I think is a more useful way to go. The legal... To my mind, the first thing that's needed is for everybody within a European system, every government, to be able to see itself mapped into a bigger picture, to see where it is in a continuum or in a space. And that's the legal framework, it's the institutional framework. I didn't mention it, but Hans flagged it there. And that's the financing models, like an insurance-based model, a long-term social insurance-based model, or funding out of current revenues, which would be the Irish approach. Like, how do you get sustainability in this? There's one interesting little technicality, which is also a way of maybe of leveraging a little bit. In Denmark, as I understand it, if you're an informal carer, as a way around a lot of the problems, the local authority will actually employ you as a local authority employee. So you could have a situation where a carer from Estonia, a family carer from Estonia, moves to Denmark and becomes an employee of a local authority in Denmark to look after their father, let's say, or mother who's come with them. And then the Danish government moves to recover that money from the Estonian government on the basis of equivalence. Now you have a situation where between Austria and Germany, the supports in Germany are mainly services, the supports in Austria are mainly cash. If you move from one to the other, they recover the money from each other because they start paying the benefit now that you're in the new country. And even they, and all it's about is cash or kind. That's a bit complicated, but they managed to make it work. But if you're taking systems that are so diverse as Denmark and Estonia, and you're trying to make these interchange mechanisms, which are already there, already part of European law, you're trying to make them operate, they are throwing up issues and anomalies. And there's an interesting learning to be had from the awkward cases there, just in terms of the edges of the comfort zone. But I do think we're a long way away from complete parity, to be fair. And that's as much about economics as it is about policy or anything else.
But it's a very interesting point, though, John, that you made. And I think Mary was making the point about how much we can learn from one another. I mean, I think your point, and I want to go to Sandra in a moment, but your point about mapping out what is the state of play, we have that to a degree, probably partly from the Commission, partly from NGOs. Stacey, can I just check with you? Where do you think we're at on the continuum of mapping out, if you like, the care situation across the member states, and what is needed to bring that up to the level, despite the disparities and the differences and a long way from parity? What do you think is the next step in doing that? Let me just ask you for that quickly. I think you're muted. Yes.
Sorry. When it comes to professional care, I think there's quite a lot of literature emerging, and correct me if I'm wrong, Hans, and pretty good literature. And I know as well that member states, coordinated by the Commission, are discussing the development of comparable indicators in the field of long-term care. So, that's work in progress. When it comes to carers, unfortunately, there's still a long way to go. In some countries, there is very good quality data, but for a majority of member states, there's almost no data about or official data in terms of census or social survey about the situation needs of carers. And so that's really missing, and that's something again where the Commission could play a role via Eurostat and in other agencies. And obviously Eurofound is doing a great job in that regard, but yeah, more could be done.
Thanks, Stacey. I think that's something we definitely need to work on, and maybe out of this seminar we can begin to put a proposition to the Commission on this. Hans, did you want to come in briefly there?
Yes, just to say that yes, there is starting to be more information on long-term care, but still, in comparison, for instance, to healthcare, it's really very little. But you notice from the European Commission increased interest in this expanding field to have more and more data.
Well, look, I mean, I really think that's what we have to push for, and that'll make such a difference, because we're not going to get the same, type of care in countries by any means. It wouldn't even want it. We all have our unique perspective on this, but there's an awful lot we can do together as well. Sandra, sorry, I've delayed coming to you, Sandra, on that question about, the gender aspect. This whole question of, increasing the participation of men in care activities and that better reconciliation. We do have the work-life balance now, and that's got to be a directive and so on. Sandra, what would you say are the kind of key things? Is it education of younger men? Is it government action? Where do you see the levers that need to be used?
Well, I suppose one of the issues in an Irish context is that our constitution still enshrines women's place in the home in our constitution, and it's something that the Citizens' Assembly are looking at the moment. But I suppose for us, one of the things that needs to come from that is for that article, that enshrining of women's place in the home, to be amended so that instead of this kind of outdated reference, that the Constitution would have an inclusive statement about the importance of care and care work done by both men and women in Irish society, and recognising care in this way. It would just, I suppose, provide the support to the valuable recognition and support to the work that's done all over Ireland by men and women. And it also invites men to take on more responsibility and, to enjoy the often rewarding, challenging, but rewarding work of care. Now, that would provide, I suppose, a very strong symbolic statement. But of course, we need the policy and legislative responses to actually deliver on the kind of socioeconomic rights. So I had mentioned earlier on around the pay and conditions for workers in the sector. And again, unless we get those pieces right, it's going to be a sector and an area that is highly feminized in that low pay kind of sense. But also paid parental leave is such an important lever. Now, we have a couple of weeks of paid parental leave in Ireland, and it was increased in the budget for a further 3 weeks. But if we look at the value of it in terms of the income replacement factor, it's quite low. So it's around 25% of the average income in Ireland. And that's much lower than, say, our European peers. Germany, I think, provides their paid parental leave would cover about 75% of the average wage. So this is a particular barrier for men taking up parental leave. As we know, men are the higher earners usually in the household. So if it's only replacing kind of a very small portion of their average income, we're not going to see men take it up. And that's been borne out quite recently by data, a study on paid parental leave. So for us, increasing that, so to make it a realistic option to give real choices to people would be a really important point as well.
Okay, John, do you want to come in quickly, and I'll go to a few other questions then?
Well, just to very quickly agree with Sandra, and to mention that Ireland, again, is ahead of Europe in that we've had paid carers leave for 2 years, paid carers leave for quite a while now, and the take-up is very low. And I think it's for precisely the reasons Sandra's talking about there in terms of parental leave. So that is a genuine, deep issue. Yeah.
Okay, that's an important one for the Minister and for all of us to mark. Just let me go to two other questions. There's a question from Borja. We know that strategies may create a momentum, but we also know they may be short-lived and end up in the cupboard. How to make sure such a strategy remains alive? Maybe it is time to push for a legislative EU instrument instead. That's one question. And then we have a question from Susan from Dementia Carers Campaign Network. Many family carers are working full-time. Can employer organisations and employment legislation be engaged and looked at to give carers of older relatives the same rights to time off as parents of young children? Now, that's a very interesting question there. Who'd like to take that one up? So that's about care. That's about John, you start off.
Yeah, just to say that we have it's adapting an initiative that's been running in the UK for a while, but we've started a project now called Caring Employers. So we're going into the workplace, because the majority of family carers are actually part-time carers and full or part-time workers. And in this case, which out to employers, that the cost of replacing somebody they lose to caring is quite significant. And therefore, it's worth their while investing in helping those people manage their caring while they're working. Now, by definition, the people who are joining this initiative are, I suppose, the most progressive and forward-thinking employers. But they're quite an eclectic mix. It's not all software companies and multinationals. There's actually quite a mix there. So I think it's a very good question. There is a tricky line between how much of it can you do on a voluntary basis and when do you come in on a statutory basis. And I think that's something that either at national or European level is always a challenge. Our preference is to do it as far as possible on a voluntary basis, with the legal underpinning advancing behind, but the leading practice should be voluntary. And I think the model of the caring employers is hopefully a way forward on that. But I think it's a very fair question.
Thanks, John. It reminds me of the struggle to get maternity leave, when we've gone to paternity leave and parental leave. And it seems to be inevitable that we're going to go in the same direction around carers, and that we need to actually. And that, as you say, voluntarily people are maybe doing it already. Mary, you'd like to come in?
Yeah, Frances, I'd just like to say I agree with John's premise there in relation to if it can be done on a voluntary basis, it would be very, very helpful. COVID-19, this unprecedented pandemic, has thrown a spotlight, across all the world on how we care for the most vulnerable in our society. But I would also like to mention today, there are many carers who are in a dual caring role. So, for example, some of them are looking after vulnerable adults, but they also may have children who would have additional needs as well. And for some carers, they are really, they're really at crisis point, because they have found the last 9 months so very, very challenging. And I think it's anytime we can talk about this, it's absolutely fantastic. And as I said previously, to learn from what other countries are doing also, and to learn the good parts.
Thank you, Mary. Stacey, what about this idea of EU legislation to support where we're going on this?
Yes, I would tend to agree with that, of course. I think the strategy is meant to be used as a compass, is meant to, to show the way to go, but then the way that translates, it probably calls for a combination of legislative and non-legislative initiatives, just like it was the case with the Work-Life Balance Directive, which also included, both aspects. Off the top of my head, for example, in terms of legislative initiatives, I think something on pensions and the gender pension gap for carers is something that should be addressed, as a matter of urgency, and access to social protection generally for all carers across Europe. But then, maybe establishing a link to the second question, there's also a long list of good examples of voluntary practices by employers, trade unions, for example, so non-legislative, in an attempt to support, working carers, because there's a clear win-win. It's good for both, people providing care, but also for employers and companies themselves in terms of reduced absenteeism and so on. So I think we need to promote both aspects.
Excellent. Thank you. 2 other questions, and then we're going to have to finish up, but I'm just going to very quickly point them in your direction, because we are about to finish in about 3 minutes. So a question from Patricia, who acknowledges the usefulness of this webinar. Thank you, Patricia. She says, care includes home supports, multidisciplinary community care referrals, and respite breaks to ensure people can remain at home. These services have been severely impacted by COVID, and it seems in Ireland that many multidisciplinary team specialists are deployed to contact tracing and other COVID duties. How can we better support family carers and the patient? Also, what about strategies for unpaid work? And then there's a statement from the Avril Easton from the Alzheimer's Society of Ireland Dementia Carers Campaign Network. She says, older family carers are often invisible and have been totally forgotten about during the COVID-19 crisis. They often have multiple health issues themselves and only receive the necessary support when a crisis occurs. They want their loved ones to remain at home, but they need access to appropriate care that should be a statutory right. I think one of the features of our discussion has been this, whether things are voluntary or statutory, the role of the state in social welfare, access to better pensions for carers, and legislation for employers, maybe leave. It's an interesting debate. I'm sure the minister is listening carefully to it. I mean, I think it's all part of a package that's emerging this morning of what needs to be done. On those two questions, perhaps very quick comments, and then I'll wrap up our session. Who'd like to come in? Minister?
Thanks, Frances. Yes, they're two very, very valid points. And I suppose from our point of view in Ireland, we're currently, we're currently working towards a statutory home care scheme, which will be delivered in 2022, which will be hugely important. One of the key enablers for 2021 is the single assessment tool, which will be an assessment of care needs and their carers throughout the country. So we are moving in the right direction, and it's not before time, to be honest, but it's hugely important that you have the same supports regardless of whether you're living. It can't be a postcode lottery.
Thank you. I mean, that's certainly, as I said earlier, a very good vision to have to move in that direction and to have the policies and the Care Commission and so on. I think that anybody like to come in with a quick comment on either of those questions? Stacey and John and Sandra, very quick comment from each of you, and then I'll wrap up, as I say. Stacey.
Yes, I would tend to agree with both points, but I'd like to add that when it comes to the visibility or invisibility of some carer groups, the same applies to young carers. So, kids not of working age who are completely invisible still in national policy debates, but also at EU level, and we're trying to change that. And also are not captured in the data available on carers.
It's a very important point. Sandra.
Just to come in around kind of that point about kind of the maybe the public funding and so on. I suppose, for us, investment in the public infrastructure is really crucial. So, if we look across Europe, countries, in terms of childcare, countries with public provision tend to have childcare services that are more affordable, more accessible, and of higher quality than countries with private service provision. And across European countries, recent research has shown that the single most important factor in kind of lowering the pay and conditions of care workers is the extent to which care is marketized. So, for us, better paying conditions, they can only come about through an increase in public funding. In terms of some of the kind of the issues around spending and that, investment in care has been actually shown to be a better post-pandemic economic stimulus than investment in kind of some of those traditional economic recovery approaches that we always think of, like construction and so on. Investment in care and the equivalent kind of spend produces significantly less emissions than something like construction. So care jobs are green jobs. And because the sector is comprised predominantly of low-paid women workers, investing in care then actually can help to reduce the gender pay gap significantly. So UK research found that the equivalent investment in care would reduce the gender pay gap by about 5% in a UK context. So, we can look at aligning our economic recovery with our goals on addressing the care economy and our goals on a kind of a green recovery or a climate-led recovery, and they're not mutually exclusive.
Thanks, Sandra. That's a terrific point, and it's one I'm increasingly interested in, that when you look at equality, diversity and inclusiveness, it really pushes up GDP. I don't think that all governments have got that message yet, but you're absolutely right. The care economy is one. I was just discussing it with an insurance group yesterday. It can also give people new markets, and there's a lot of different aspects to it. John, final quick word from you.
2 quick points. The first one is I don't think the statutory right, and this isn't taking away from what's happening, which is positive, but it's not a magic bullet. There are still constraints through finance and through staff and through various things that even if the statutory thing is there, there'll be rationing if the service can't be met. I do think Sandra's point about the economic multiplier effects of spending in the care economy is a really good one and absolutely true. And the third thing is just following on what Stacey said, we published a report earlier this week analysing a WHO report on research in Ireland, which shows there's actually over 60,000 young carers in Ireland, just to let you know.
Okay, well, look, thank you all so much. You're all passionate about this issue, as I am. I want to thank you all for your very insightful comments. We're going to have a webinar, a recording of the webinar will be available from Eurofound and the European Parliament Office in due course, so we can take the lessons and draw out our work programmes, as it were, from that, based on the discussion here today. I want to thank each and every one of you in our panel, and Dennis, who joined us earlier. I'd like to thank the staff of the European Parliament Office here in Dublin, who has always been fantastic in terms of the organisation of this webinar and put in a huge effort, along with my own team. Conor, Lynn here in Dublin, and Una and Marcus in Brussels have done an amazing job. And Conor, you've taken a huge amount of the organisation. Thank you very much indeed. And also to say to all of you who've been listening and joining in, logged in, thank you again. Do stay in touch with us if you'd like to take up any of these issues. We'd all, I'm sure, be very happy to hear from you, and you'll get us on our email addresses, or indeed through the European Parliament Office or Eurofound in Dublin. So thanks again, everyone. I think it's been a really worthwhile discussion. Really appreciate your expertise, and thank you for taking the time to share it with us today. Thanks, everyone.
Thanks very much.
Thank you. Bye-bye.